I'm Ed Pruitt, Editorial Director for NEJM Catalyst, here with Mark McClellan, MD, PhD, who is Director, and Robert J. Margolis, MD, Professor of Business, Medicine, and Policy at the Duke Margolis Institute for Health Policy at Duke University. I'm here to talk about healthcare policy in 2025 and beyond with Mark, who obviously has a great background to speak to this topic, not only with his current role at the Duke Margolis Center, but also at the Centers for Medicaid and Medicare Services and the Food and Drug Administration. Mark, thanks for taking some time to talk.
Ed, thanks for having me on. It's good to talk with you.
So you and I spoke before the general election about healthcare policy when we were preparing an NEJM Catalyst Insights report on that topic. And at that time, you seemed to be expecting a more balanced outcome from the election. So what's your take now in the aftermath?
Well, yeah, and I think a lot of people had a hard time predicting the outcome. It seemed close in the polls, though the polls, I think, were largely right, that the edge went to former president, soon to be again President Trump. He ended up having a lot of swing groups break for him, including some swing groups that people didn't expect, non-white voters and a lot of low-income voters. But in the big picture of things, although that was enough to win all the swing states, a lot of electoral votes, the House and the Senate, it was still less than 50% of the vote, and that translates to some very small margins in Congress. Three Republican senator margin on the Senate side, and only two members of the House, 220 to 215. So that's an even tighter House than was the case prior to the election. It just reminds you that there's a good deal of division underneath this really notable surface three House Senate presidency sweep for President Trump. I think the other thing that was hard to predict or that was unexpected for many related to healthcare, especially, is this was not an election where, at least for most of the election, healthcare issues were prominent. But as you know, in September, Bobby Kennedy Jr. endorsed President Trump in conjunction with President Trump promising him a major role or going wild on health in the administration. And that's brought a new Kennedy perspective, a populist perspective to some of the healthcare issues that I think President Trump believes helped him get some of those swing voters at the end. And that includes emphasis on public health, skepticism about some of the traditional evidence that's been the basis for recommendations around preventing diseases, particularly vaccines, and probably more action related to areas like nutrition and perhaps even environment than people were expecting.
Make America healthy again. Well, that's a laudable goal. So we'll come back to some of that, but first I want to talk about the recent Insights report, which is on our website. And according to the healthcare leaders and clinicians who responded to that, the two most important healthcare policy issues by a very large margin were improving affordability and improving access to care. What do you foresee now regarding those priorities?
I think there will be some focus on that in the days since the election. President Trump and his advisors, including Elon Musk and Bobby Kennedy, have focused on issues like drug pricing, getting prices down, both by potentially building on the IRA price negotiation and other tools that CMS has and HHS has. President Trump has also talked a lot about middlemen, and there's pending legislation related to pharmacy benefits management, prior authorization, things like that has considerable bipartisan support. Also, a big theme in the campaign was reducing federal spending generally, including spending in healthcare programs. President Trump was a strong defender of saying he's not going to cut Medicare benefits, but that's not the same thing as keeping Medicare spending where it is. And there have been proposals around ways to do that by such steps as site neutral payments or other reforms in Medicare and tightening up the Medicaid program significantly.
Hmm.
So those are, I think, approaches that you'll see related to prices and also on spending. Trump in the previous administration, President Trump emphasized price transparency, helping people shop around more, empowering consumers. And I could see more steps in that direction as well. But I do want to emphasize that there will also be some efforts around public health. Bobby Kennedy has talked about getting costs down by increasing disease prevention efforts, by doing a better job of managing chronic diseases. How exactly that will play out is not yet clear. And then finally, back to the public health point, again, some skepticism about recommendations coming from experts on medications and especially vaccines that have been shown to have significant impacts on disease prevention. So those are areas to watch very closely.
I'd like to follow up on Medicare and Medicaid, and also Medicare Advantage. You were just talking about the first two. MA has been viewed as a target for controlling costs. What is the outlook now for Medicare, Medicare Advantage, and Medicaid?
Well, let me start with Medicare, including both Medicare Advantage and traditional Medicare. So, as you and listeners know, Medicare Advantage is now most of Medicare and continuing to grow, up about 54% now, and perhaps on track to 60, 70, 80% over the next decade. So that's where most of the money is. And there have been bipartisan concerns about the way that payments to Medicare plans are working today is leading to higher costs, even if Medicare Advantage plans themselves are reducing spending, and also concerns about quality and transparency in Medicare Advantage plans. I do think that the Trump administration is going to continue to put an emphasis on private plans delivering more innovative benefits. Dr. Oz,
Hmm.
my soon-to-be successor at CMS, has been a strong supporter of Medicare Advantage, for example. But I do think there are ways to modernize how the Medicare Advantage plans are getting paid. You know, it's essentially off a system that we put in place when I was at Medicare at the beginning of the Medicare Advantage program. It's based on essentially fee-for-service claims data, which we know is not accurate for diagnoses, especially since people with risk factors tend to be underdiagnosed and don't show up in claims. And so I see some reforms coming there that could save money, but I think there will also be attention to making Medicare Advantage stronger, not weaker. In traditional Medicare, like I said, some steps to maybe reduce payments to hospitals, so-called site neutral payment adjustments, and steps towards more transparency to try to equalize payments. 340B payments, maybe reducing what Medicare pays for drugs towards what the 340B discounts are. Steps like that, I think, are absolutely on the table. And on the Medicaid side, there were not similar promises from soon to be again President Trump not to cut benefits or spending. And there's a long list of proposals that many Republican supporting groups have identified that could significantly reduce spending by basically tightening up the entitlement and the way that Medicaid works. The bolder proposals there would be steps like converting it more to a so-called block grant program. I think that's politically unlikely given the closely divided House and Senate. More proposals in the same direction that I think have more opportunity are maybe increasing work requirements for the expansion populations, the low-income adults who are in Medicaid. That could save $100 billion plus if fully implemented, as well as steps to tighten additional payments in the Medicaid program, so-called state-directed payments that tend to go to hospitals and other healthcare organizations, where there have been questions raised about how much that's actually tied to delivering on the goals of the Medicaid program. So that could be 100, $200 billion in a combination of legislative steps and administrative actions by the Trump administration. And then finally, and this came up in the survey too, in 2021, the Biden administration expanded tax subsidies, the tax credits for people in the Affordable Care Act exchanges with kind of modest to medium, middle class incomes. Those extra tax credits are scheduled to expire in 2025. And I think there's a good chance that those costs will be reduced as well. All of that's going to raise concerns about less access to care, lower quality of care, maybe higher uninsured rates. So that's going to be a big part of the political debate in 2025.
Well, thank you for that very clear summary of a complex landscape. Another topic that came up in the Insights report was value-based care and a great
Yeah.
deal of support globally for value-based care. What's the outlook now?
Well, we've seen steady movement in both the previous Trump administration and in the Biden administration towards more payments and more people getting care through value-based arrangements. Most notably in programs like Medicare Advantage, which is, again, now most of Medicare. Medicaid managed care is now the vast majority of Medicaid coverage. And in both programs, the federal government and the states, the federal government through CMS and the states through their Medicaid programs, are moving more payments towards holding providers and the Medicaid and Medicare plans accountable for delivering on better health, including addressing some of the non-medical drivers that have such a big impact on health. And I think there's an intersection there with the emphasis from Bobby Kennedy on putting more resources into preventive care and into chronic disease, risk factor detection, and management. Bobby Kennedy's already talked about maybe upending or replacing the current so-called RUC, the committee run by the AMA that sets the relative payment rates in fee-for-service Medicare. I think that this new administration is going to find ways to shift more resources in the payments in the Medicare Advantage program and encourage states to shift more payments into supporting prevention, chronic disease management. How bold that's going to turn out to be still remains to be seen. And then on the traditional Medicare program, today at more than 30% of beneficiaries are getting their care through so-called accountable care organization programs where the providers are paid in part, or in some cases a lot, based on keeping total costs down while improving some important measures of outcomes and patient experience. And I see the administration putting more emphasis there. In the Trump 45 administration, there are some bold proposals for so-called direct contracting between the traditional Medicare program and physician groups or health systems that would essentially take out the insurance company as a middleman and just do direct payments for healthcare organizations that would be at substantial or full financial risk, but also have more flexibility in delivering on better outcomes. So stay tuned for some steps in that area as well. And then I do want to emphasize that outside of Medicare and Medicaid, HHS has some major public health programs, CDC, around infectious disease and other population health management issues, including use of vaccines, NIH support for research on to improve the future of our biomedical capabilities, including prevention. Emergency preparedness. We've seen more cases of H5N1 in humans cropping up, and there's always a risk of new infectious disease or other public health emergencies. That's also an area where there could be significant changes given Bobby Kennedy's priorities.
Well, to close, I did want to come back to the public health implications. You outlined some possible pluses and some possible negatives, at least from a public health standpoint. Let me ask the question this way. We are hearing from people who work in public health a lot of deep concerns. Do you think
Yeah.
that's warranted?
I think those concerns are warranted, and I think these are questions that senators should be asking, the public should be asking as the confirmation process for Bobby Kennedy goes forward. For the last decade, Ed, he's been at an organization, Children's Health Defense, that has been very critical of science-based vaccine recommendations. One of his senior advisors, who's part of the transition team, has actually, his law firm, he's a plaintiff's lawyer, has filed a lot of citizens petitions to remove vaccines from the market or significantly restrict their use. It includes pediatric vaccines have been critical for preventing outbreaks for measles or worse, even polio. And it's important for people to know that there are opportunities for the HHS secretary to directly influence some of these important vaccine policies. The authority that Congress gave the executive branch goes to the HHS secretary. That's typically devolved then to the CDC or the FDA or the NIH and their professional staff to make the scientific decisions. But those can be within some bounds overruled. So, for example, changing the recommendations for vaccine schedules for children, or changing the way that funding for the vaccine for children program works on some very significant impacts that could happen administratively. So I hope there's a clear discussion about those issues. Bobby Kennedy said he doesn't want to make big changes in vaccines, but you got to look at the past record of his advisors, as well as hopefully get to some specifics on these important changes. And my hope is that we'll find ways to get better evidence to address some of the concerns that many Americans have. There's a growing distrust among many Americans in public health expert recommendations. And my other hope is that we'll keep that science-based. My other hope is that these steps towards better nutrition, FDA has just come out with a new proposed rule on labeling healthy foods. That's something that could be built on. FDA regulates 80% of the food supply. And that emphasis on disease prevention and chronic disease risk factor management through science and evidence and effective strategies and ways to build those into our public and private healthcare programs so they are more population health focused. That all seems good, but these are very important issues for physicians to watch in the coming weeks.
Mhm. Well, Mark, thank you for your really expert commentary on major issues coming up on behalf of our audience. We really appreciate it.
Great to be with you, and appreciate the New England Journal Catalyst attention to these very important public health and healthcare policy issues.